Hi, today we're just going to be doing a brief lecture on the levels of prevention. This is a foundational concept for public health and public health nursing. And essentially, we are describing three simple levels of how we look at promoting health and preventing disease within the community. So this is the visual that I hope will be helpful for you. But essentially it says, for the most part, we want to be providing primary prevention, so disease prevention for all levels. And this is where we're mainly focused on the well population. For people at risk of a health problem, we want to be doing secondary prevention, which is mostly screening to discover those who are at risk and to help them learn how to do early intervention and control of risk factors. And then finally, what we're looking to do, if all else fails, we end up with tertiary prevention, which is what we're usually familiar with acute care. And this is dealing with people who already have illness or injury and helping them rehabilitate or recover. I just want to note that at the bottom, this says that all people are at multiple levels at once, and that it's not like we all just sit in one of these levels. We have risk for certain health problems. Perhaps we do have chronic conditions already, and then in some regards, we're healthy. And so this is something where we're kind of falling all over the place, but helps us organize our public health efforts. So for primary prevention, this is mainly what we refer to as health promotion, and there's three main categories for that. There's education of to the public, there's promotion of favorable conditions, and there's protection. Um, Public service announcements, handing out pamphlets. These are just a few of the ways that we educate the public. I have this very old video for you that you might recognize. Um, but this is a video, I think it's from the late 80s or early 90s. I certainly remember it from my childhood. It's a PSA commercial that was on TV a lot back then, on showing what your brain looks like on drugs. And it's a guy cracking an egg in a skillet. So just have that link for you there. It's kind of a fun memory to think of, a very pronounced public service announcement that I certainly remember growing up. Promoting favorable conditions. These are just a few examples. Public policy. This is especially relevant for people who are involved in city planning or urban development, and where they advocate for policies so that when we're building new neighborhoods or increasing retail space or business space, that we're also looking to prioritize green space, meaning parks and trees, so that people have safe places to play and to exercise outside. There's actually been some studies that have looked at lots of studies actually that have looked at different communities and individuals, and people who live in closer proximity to green space have better health outcomes when they account for a lot of other variables. So it's really interesting that green space makes a huge difference. Another thing is advocating for markets with fresh produce in a lot of areas that are frequently termed food deserts, and these are often low-income, poor neighborhoods. They don't have access to supermarkets that have fresh produce. Maybe they only have access to convenience stores where there's maybe a stand of bananas if they're lucky. And so we need to continue to work on promoting favorable conditions. One way this has proven true in San Diego is that a lot of the farmers markets in San Diego now take CalFresh credit, which used to be what we consider food stamps, and so that people can use that government assistance to pay for healthy food and not just boxed or canned things. A local example in my neighborhood of Point Loma is, in the last few years, they have done a lot of construction on our streets to create a safe bike path to Dana Middle School, where it's actually where my oldest son goes to school. So basically what they have done is they have widened streets, created a bike lane, but actually put the bike lane, it looks kind of funny, but they've put a bike lane in between the sidewalk and the parking spots. So it looks kind of weird that way, but it allows young children, 11 and 10, 11 and 12-year-olds, to be able to ride in a protected bike lane all the way to school. There are a lot of kids, including my own son, who rides his bike to school, and this helps promote favorable conditions where kids can feel safe, parents can feel safe, and kids can get their exercise on the way to school. And the last way is protection. And so promoting hand hygiene, especially during this pandemic, is huge. Providing immunizations is a big piece of that. The picture here shows efforts in San Diego when we were going through our Hep A epidemic a few years ago. This kind of shows two things. This shows a flyer that's being posted to educate the public on how to prevent and protect themselves from Hep A, but it's being posted on a portable or a temporary hand washing station, which they did a lot of that, especially in areas where a lot of homeless people congregated to help promote hand hygiene. So it's educating and it's offering a promotion of favorable services. So my question to you at the bottom, I'd love for you to begin to think about how are we doing these three things: educating, promoting, and protecting the public during our current COVID-19 pandemic. Illness prevention is what we consider secondary prevention. So the goal here is how can we reduce the risk of disease. This mostly has to do with screening. And one way that we can do that is using instruments such as a health risk appraisal. So I'd love for you to click on the link here. This is a free instrument that you can use for yourself. It's fun to fill out for yourself and to also use it when you're working with clients to help them identify things that they are at risk for, mainly chronic diseases. It asks a lot of different information that I have listed here, and then it tells you your real age and then your risk age, what your body's age actually is more like because of different genetic and lifestyle factors. So it's just a really nice and easy way to display that to clients. Another thing that a federal organization that really plays into secondary prevention is the U.S. Preventive Services Task Force. This is a group of medical professionals, mostly physicians, at least one nurse, the last time I checked. And this provides this group of individuals reviews the evidence on all sorts of preventive healthcare, and then provides recommendations. They rank their recommendations, give it a grading score as to how strong the evidence supports it, but they provide recommendations on all different areas of healthcare on how to screen and how to provide early intervention services to who's at risk. And so if you click on this link here, that'll take you to their website, and I just encourage you to peruse that and look at things that might be of interest to your own specialty currently. I don't need to talk much about this. This is what we're more familiar with in nursing, is this acute care, tertiary prevention. It's kind of confusing because we call it prevention, but this, it is what it is. But these are the things that we do once people are already sick. We learn to help them manage their chronic conditions, provide health counseling, refer to a multitude of services. I'd like for you to click here on this link. I'll do this as well. The leading health indicators. This is still looking at Healthy People 2020 objectives, and specifically leading health indicators were specific objectives that Healthy People chose to focus on and really mark our progress over a 10-year period. And then you can look at these with different categories and then more specific objectives, and to see where we're going. Are we improving? Do we not have much change? Did we meet our target that we set out 10 years ago? And so this is really interesting to kind of get an understanding of what we're looking at nationally regarding public health. There's something to do with cancer, there's something to do with diabetes, environmental health, family planning, the list goes on. Just real quick, I will note right here in red that there's only a few that are getting worse, and unfortunately these are related to mental health and then oral health for kids. I'll let you explore that more on your own. That's all I have for you today.